Hello everyone, welcome back to my channel. In this video, we will be talking about soft palate, uvula and tonsils. Let's begin our today's topic. If we talk about palate, it forms the floor of nasal cavity and it forms the roof of the oral cavity. Okay. Now, there are two types of palate, hard palate and soft palate. Hard palate, I had already made a detailed video, but let's talk in brief about it. Hard palate is the anterior part of the palate, and soft palate is the posterior part of the palate. Hard palate, why it is hard? Because it is made up of bone. And which bones? Palatine process of maxillary bone and horizontal plates of palatine bone. So basically maxillary bone and palatine bones. Now the interesting thing is it is covered by keratinized mucosa. Why? Because it has to protect our palate. Keratinized mucosa has all the properties which helps to resist the mechanical stresses of chewing. Underneath this tough mucosa, we will find palatal salivary glands. Remember, palatal glands are mostly mucus and they are located beneath the mucous membrane of hard palate and soft palate. Although they are very small, minor glands plays a big role in contribution to the oral fluids. Now let's move posteriorly to the soft palate. Unlike the hard palate, the soft palate is flexible. Why? Because it is mostly made up of muscle. The main ones are palatopharyngeus, palatoglossus, levator villi palatini, tensor villi palatini, and the lastly uvula. Now this muscle works together to facilitate swallowing and in speech. Interestingly, this soft palate is covered with non-keratinized mucosa. Now under the non-keratinized mucosa, there lies submucosa. Submucosa has two zones. The anterior one, which is made up of fat, and the posterior zone, which contains the mucous glands. Supporting all of this is a palatal aponeurosis. This is nothing but a fibrous connective tissue of soft palate which provides strength and contributes to its structure. Let's talk about the nerve supply of the palate. So the motor innervation is through the pharyngeal plexus except the tensor villi palatini which is supplied by the mandibular nerve. Now what is pharyngeal plexus? Pharyngeal plexus is formed by the branches of glossopharyngeal nerve and the vagus nerve. Sensory innervation is through the maxillary nerve. Now which branches of maxillary? Greater palatine nerve. It is located posteriorly. It will travel anteriorly. And nasopalatine nerve which is located anteriorly and they will join the greater palatine posteriorly. Blood supply of the palate is through the third part of maxillary artery. And we know maxillary artery is a branch of external carotid artery. Now which branches of maxillary artery? So greater palatine artery, it will travel with the greater palatine nerve and vein from the greater and lesser palatine foramina. And the spinopalatine vessel, it will travel with the nasopalatine nerves from the incisive foramina. Guys, the nerve supply and blood supply is a very important topic, especially if we talk about the palate. It's always confusing between the nerves and the vessels. So the nerves are greater palatine and nasopalatine and the blood vessels are greater palatine and spinopalatine. Okay, let's move on to the next slide. So for uvula, we just need to remember few points, that it is suspended from the soft palate. We can see in the diagram. Now whenever there is a bifid uvula, it means because of the incomplete fusion of palatal shelves. Unilateral damage to pharyngeal plexus will cause the uvula to deviate to the opposite side, that is contralateral side. So for example, if the right side of pharyngeal plexus is damaged, but the left side is functional, so the left side, whenever it will contract, it will pull the uvula towards left side. So the soft palate, it attaches to the tongue by palatoglossal arches, and the soft palate attaches to the pharynx by palatopharyngeal arches. Okay, let's talk about the fosses now. Fosses are between the anterior and the posterior pillars, and they contain the palatine tonsils. We will see what are those pillars. So we can see in the diagram that the yellow color thing is the palatoglossal arch, and behind it is the palatopharyngeal arch. This palatoglossus muscle, or we can say palatoglossal fold, this one forms the anterior pillar. The function of it is to draw the soft palate and tongue together to help in swallowing. Posterior pillar is made up of palatopharyngeus muscle, or we can say palatopharyngeal fold. It will elevate the pharynx, and also it helps to close the nasopharynx. Ultimately, this both of them functions to facilitate swallowing. Let's talk about tonsils now. Tonsils are lymphoid tissues which protects the throat against infection. First one is the pharyngeal tonsils, also called as adenoids. We can see in the diagram that it is found very posteriorly. It is found on the posterior wall and roof of the nasopharynx. This one has no lymph sinuses or crypts. It's just epithelium and connective tissue. Second one is the palatine tonsil. So this one is located in the isthmus of fosses. Isthmus means a center place. So between the palatoglossal and the palatopharyngeal fold on either side of the posterior oropharynx. Now the fun fact is that palatine tonsil reaches maximum size during childhood, after which it diminishes. This one has crypts and lymphoid follicles. What are crypts? Basically, they are folded spaces which will help trap the bacteria. And it is covered by connective tissue and epithelium. Now, the last and the most important is the lingual tonsil. We can see in the diagram that they are found on the dorsum of the tongue posteriorly. It also has lymphoid follicle, each with a single crypt. Talking about the tonsils of oral cavity, they are arranged in a ring-like structure which is called as Waldier ring. Now, pharyngeal tonsils are located superiorly. Then there are two tubal tonsils, two palatine tonsils laterally, and one lingual tonsils inferiorly. Now the tonsils are collectively called as mucosa associated lymphoid tissue, and thus they contain T cell, B cell, macrophages. They are very important for fighting against infection. Whenever any bacteria enters the nasopharynx or oropharynx, these are the first line of defense against them. From this slide, we just need to remember that the two soft palate muscles, tensor villi palatini and the levator villi palatini. The function of tensor villi palatini is that it tenses the palate and it opens auditory tube whenever there is mouth opening, and it is supplied by the mandibular nerve. And the levator villi palatini, it elevates, elevator, the name itself says that it elevates or raises the palate during swallowing, that is the pharyngeal plexus of vagus nerve. So question time. Which of the tonsil forms the inferior part of the Waldier ring? So lingual, palatine, pharyngeal or tubal? We remember we studied today that lingual is the most inferior portion. It is located on the dorsum of tongue posteriorly. So the correct answer is lingual tonsil. Next one. A 5 years old girl is undergoing a bipolar tonsillectomy. What structure forms the anterior border of the tonsillar bed? Now remember, we need to just focus on the second part of this question, that what forms the anterior border of tonsillar bed. Is it palatopharyngeal, palatonasal, palatotonsillar, or palatoglossal arch? So you can just pause the video and think about it. We did study this in the slides, that palatoglossal arch forms the anterior portion of the pillar, that is the yellow color thing seen in the diagram. Thank you so much guys for watching this video. If you really enjoyed studying with me today, then please do like, share and subscribe to my channel. It really motivates me, and I will be really grateful for that. Thank you again, and till then, happy studying. See you all in the next video.